Hi, happy July 4th. It is a beautiful time of year here in Olympia, and things are really speeding up at the Healthcare Authority. I'd like to do a rundown of some of the activities in June and prepare a little for what's coming in July. So I've been out and about representing our work around the country. Most recently in Washington, D.C., I presented at the Modern Medicaid Alliance, talking about our value-based payment strategies and our successes. Because many of you have heard, we have now been ranked the 4th highest performing health system in the country. The Commonwealth Fund does a scorecard, and Washington moved up 10 slots from the baseline of our last performance, and we're really proud of the progress we're making. I also went to Indianapolis to meet with the national nurse practitioners about residencies and fellowships. Now, many of our Washington partners were there. I was pleased that the audience was half physicians, half nurse practitioners, and physician assistants. They're leading an effort to design residencies, fellowships, and internships for advanced practice providers. They know that as people graduate and come out of school, they really need some specialized education and training. I was lucky to travel over to Spokane to work with our Emerging Therapies work group. Now they're getting together to really think about and plan for what are we going to do as we have more of these extraordinary emerging advances with drugs and whatnot that are very costly. How are we going to sort out their efficacy? How are we going to understand the costs related? And how are we going to plot a path forward? So that process is beginning. And there will be more meetings to come, and most of those will be held over here in the western part of the state. There was a very successful public option meeting about Cascade Care. Governor Inslee had a listening session, and we were fortunate to welcome about 300 participants who informed the governor about their ideas about the public option, and we'll see that work take off in partnership. The authority are the ones that have to implement the contract and work with qualified health providers, but it's going to take an extraordinary effort here in the state as we're the first in the country to launch the public option. I also attended the Primary Care Summit that was held here at CTAC, and we did some amazing listening again with our primary care providers about what are the pain points in all of the transformation efforts that have gone on? What's working well? What do we need to course correct or improve on? That work comes into great convergence with the work of the multi-payer group, where all the plans get together as well. They too have been analyzing what's been going well, where do we need to course correct, what are the pain points in the system delivery. So we're really pleased with this ongoing transformation successes, but it really requires all of us to keep listening and partnering and working with our external stakeholders. So as we go through the summer, please enjoy this light, get out, move around a bit, make sure you pace yourselves as we have to dig in and keep implementing. We really need to keep pursuing being the healthiest state in the country, and it's fabulous how far we've come, and congratulations to all of you for being 4th healthiest state performing system in the country.